So we know from several studies that heart attacks do increase around the time of Christmas and New Year's. There are several risk factors that put us at risk of having heart attacks, like we all know, like age, male gender, family history of heart disease. Stress around the holidays, that can be stress on our mind, stress on our body, stress on our behaviors. What I mean by that is there's certainly emotional stress of just preparing for the holidays, as well as financial stress for some of us, being able to make it the best Christmas or the best New Year's ever. So there's a lot of stress from those things that can affect our mind, and we know from a lot of studies that that kind of stress can increase blood pressure. All those things can increase the risk of having heart attacks. Additionally, there's the stress on our bodies. You know, we're trying to run around and do more than what we're used to doing. The things that I tell everybody to be careful about and watch out for are things like chest pain, shortness of breath, dizziness, and then those are the things that we all know about, but then there are a couple other things that we should also be aware, because some patients may just have pain in their jaw or pain going down their left arm. If those things happen with physical exertion or in the setting of an emotional stress, that's even a higher likelihood that the patient may be having a heart event. So there are a lot of things one can do to help avoid some of these stressful situations. Of course, we want to be with our families, and of course, we want to be able to do these things and have a happy, jolly season of Christmas and New Year's. The things that one can do is make sure that you take time out for yourself. You know, we are so programmed to help everybody and make it the best Christmas or best New Year's for everybody. It's really important for us to take time out for ourselves and take that moment or two to relax and take it easy and make sure that we do not jeopardize our own health, especially for the patients who already have a history of heart disease, whether it's shopping for our friends and family, preparing a meal for them, and all those things can also lead to stress on our bodies. And finally, some of the things that we may be really good about throughout the whole year, like taking our medications. If there's a lot of stress on us and we're traveling, there may be a time period where we miss our medications. Patients may not be as cognizant of making sure that they get good exercise and good sleep, and all those things add up to the stress on our mind, on our body, and our behaviors, which can lead to increase in heart attacks. People tend to defer care around the time of the holidays, because as everybody is enjoying their holidays, they do not want to leave the party or leave their families, friends and family, and go seek care, even if they're having symptoms. So what we do end up seeing is that people get delayed care, which actually compromises their care and makes them a lot more sicker and more difficult to take care of. And they come in January or February or God forbid that they don't make it to the hospital and don't make it to the medical establishment. So I would really recommend for everyone to be aware of those signs and symptoms and seek medical care as early as possible.